Hello, my name is Jackson Anderson. I'm a third year medical student at the University of Miami Miller School of Medicine. I'm working with Taha, Rasul, and Daniel Berholz, who are also third year medical students at University of Miami, as well as Dr. Armen Henderson, University of Miami. We're working through the Miami Street Medicine Clinic, and today I'm going to be presenting a poster titled Personal Identification as a Barrier to Care for the Unsheltered in the Miami Medical District. So, just a little background on why we decided to investigate this topic. We found that our identification, personal identification, could potentially serve as a significant barrier to care for unsheltered individuals or people who have difficulty obtaining identifications, or may be at higher risk to have them stolen. Because personal identification is necessary for voter registration, in order to get employment, in order to register for school for classes, and then also to access social services and be able to obtain insurance and health care. So it could potentially serve as a pretty significant barrier to care for the unsheltered population. So we wanted to assess their possession of and their access to personal identification. So the way we did this is that a group of students and physicians would go out every Saturday from April of 2021 to January of 2022 and interview patients. They were able to interview 49 patients in this time period about their identification, about personal identification. So they would ask, do you currently possess a personal identification? If you do possess a personal identification, what type of identification is it? And if you do not possess a personal identification, do you need a personal identification, or do you need help obtaining personal identification? So the results showed that of the 49 interviewed, 32 did possess personal identification and 17 did not. So that was about a 2/3 to 1/3. 2/3 had it, 1/3 didn't. Of those who did possess personal identification, roughly 34% held Camilla's House IDs, Camilla's House being the local organization supporting unsheltered persons in Miami with temporary housing, healthcare, and educational opportunities and employment opportunities. Then beyond this, another 28% held driver's licenses, mostly Florida driver's licenses. And then beyond that, another 15% held state IDs, Florida state IDs. Beyond this, we had a few individuals who held out-of-state identifications, government identifications, VA benefits cards, and unknown identifications. And then we also assessed whether or not patients needed help obtaining identification. And of those who did not have identification, of the 17 interviewed, 8 of those who did not have identification requested help, and 5 state they did not need help, with an additional 4 who did not reply to the question. So in conclusion, kind of where we came out of this is, while the majority of patients, about 2/3 of them, did have identification, there's a pretty big variety in types of identification they had, with the most having Camilla's House ID. We through our research, found that a lot of shelters and organizations are providing identification for unsheltered individuals, which can be very, very helpful. In the case of Camilla's House, this helps them to access Camilla's House's services for health care and for shelter, and additionally serves to provide them identification should they need it, if they're in the hospital, if they're arrested, if they're and so on and so forth. But it doesn't serve in any official government capacities. And organizations like Camilla's House are working to help unsheltered individuals gain access to things like birth certificates and driver's licenses, but this can still serve as a pretty significant barrier to care, because we still found that 1/3 of participants did not have identification. So going forward, we believe these programs are greatly benefiting the community, but they need to be expanded so that we can continue to decrease that gap and decrease that 1/3. As well as help obtain government IDs so that unsheltered individuals can get insurance, housing, so on and so forth, employment, and beyond. So thank you for your time. Looking forward to hearing back.